awareness for disease outbreaks to limit their impact on public health and on food safety. They've also strived to promote the responsible use of antimicrobials and medicines in animals to fight AMR. And they also aim to promote innovation in veterinary medicines, including vaccines, to support preventive health measures. But as we look at the future, what should the EU's next priorities be in this next mandate? And how can the One Health approach really advance preventive strategies? Today we have a lot of ground to cover to try to answer these questions, and I'm honored to have a fantastic group of speakers and panelists here with us today. So let me go through today's agenda. So we're going to have some opening remarks, and then we're going to move on to our panel discussion. I have lots of questions, and I'm sure you all do too, so we're going to have some Q&A time at the end, so rest assured you will have a chance to ask your questions. And just a couple of housekeeping remarks. You may notice that there's some lunch activity happening downstairs. For our speakers and panelists, we encourage you to please speak directly into the microphone, whether here or on stage when holding it, and to speak as loudly as you can so that we can hear you. That goes for me as well. And secondly, this event is being recorded, but it is not being live streamed, and we have a photographer, so we just thought to let you know. Now, before I hand it over to our first speaker, I would like to take a moment to thank our partner in this event, EPRUMA. I would also like to thank MEP Vytenis Andriukaitis for hosting this event, and MEP Paulo de Nascimento Cabral for hosting this event. I practiced that. Did I do okay? Okay. Now, on that note, without further ado, please join me in welcoming our first speaker for his opening remarks, our host, MEP Vytenis Andriukaitis, who is from Lithuania and is with the Socialists and Democrats group. Welcome.
Thank you so much. Hello, everybody. You know, I see a lot of like-minded friends around us. Like-minded. Can you imagine? We are repeating One Health approach. It means that we need a lot of friends in different areas. Now I see Bernard van Gotham. He is the biggest teacher of mine, because he teaches me to understand what does it mean, One Health approach. When I started my work being commissioner for health and food safety, we both, at that time, we both were in very big troubles, because on one hand, you know, some argued about necessity to put on the table animal welfare strategy. Do you remember? Of course. And then others asked us, oh, look, please go forward with you know, fighting against AMR. And we decided to choose both. We developed we developed a good strategy. And in 2017, European Commission adopted the European Union One Health Action Plans against AMR, which included all three components, human health, animal health, and environment. Of course, the environment component is a very difficult one, because it's very difficult to monitor, to see, and to understand. But we propose to all of us to have promise. Look, the promise was making the EU a best practice region. You know, where we are now, I think we are okay. Mainly globally, we are still a best region. Do you agree with me? I think yes. Second, boosting research, development, and innovations. It's a very serious topic, very important. Of course, keeping in mind that we need to have new antibiotics, and we invest a lot in new antibiotics, which should be used directly only to human and some only to animals. You know, it's a very sensitive area, but I think that we did it. And third, shaping the global agenda. And this shaping the global agenda, can I remind you? You remember, European Commission proposed one global health strategy. And after COVID, we all were very keen to have pandemic treaty. Of course, it should include, no doubt, to include, One Health as ground, speaking about pandemic treaties. But where we are now, in the United States, they decided to go out from WHO. It means that also go out from animal health organization. It means that also go out from food and agriculture organization. Quadripartite component is the big threat today. And we need to understand now, we need to speak openly. But now, as never before, it's important to say how is dangerous to see those, actors who do not understand what they are doing. Because they can create a lot of challenges and diminish our efforts to have One Health approach. I do not repeat what was done in those areas, because I finished my job in 2019, and in 2020, COVID struck all of us. And then you see how people started to immediately understand what does it mean One Health. Before, we repeated only between our, like-minded friends. But after pandemic, all now are using mantra, One Health approach, holistic approach. But what does it mean in details? It means that we need to understand that One Health approach requires a lot of efforts. A lot of efforts to first of all, to develop effective collaboration between administrative and governance bodies, between institutions at local, regional, national, and international levels. That is the main question today when we are speaking. Our topic is today more or less such quite narrow. But please keep in mind that we need to think together, and to keep in mind that now as never before important to develop multi-sectorial approach and multi-sectorial management when we are speaking about One Health approach. It is a very difficult one, because silo mentality affects us in every corner. If you look into some leaders who are denying climate change, because science says that now we are facing triple crisis, climate change, nature loss, and pollution and waste, which also affects human and animal health. But some are denying climate change. Some are denying, such understanding. What does it mean? How globe is interconnected, and what can we do together now to being progressive and to putting One Health approach high on the political agenda. Sorry to say, my initial remarks, I have no chance to repeat something which you know very well, but I just only try to raise questions to be a little bit emotional, loudly speaking, because you ask me to do it. Thank you.
Thank you very much, MEP, for your impassioned opening remarks and for indeed heeding my clear ask to speak loudly into the microphone. Now, please join me in welcoming MEP Nascimento Cabral for his opening remarks. Thank you very much.
Good afternoon to all. And first words to congratulate our moderator with the excellent accent in Portuguese, so thanks a lot. Of course, to thank the Parliament, the Parliament, and EPRUMA for this organization, also my co-host, MEP Andriukaitis. It's quite interesting to talk, quite interesting issue to talk. And when I was already preparing this intervention, I arrived at my airport. I'm coming from Azores in Portugal, an outermost region. And I'm arriving Friday evening at my airport, and I had this sign saying that be careful, beware with what you are bringing, foods, vegetables, meat, etc. And at the end it says One Health. So this approach that you just referred now, it's spread even in the airports, and I believe that it's really One Health. We are having this idea that I believe when we talk about and put it on the singularity, I think it's easier for all of us to get together and work. I will make the analogy with the oceans, for instance. The Commission started with the Oceans Pact, and now they correct it. It's Ocean Pact. So why it's an ocean pact when we have 5 oceans? It's because we need to address all the ocean. So this is what we need to do right now. We need to address all health, human, animal, and of course plant health. it's quite important to have all of these areas fulfilled, because health doesn't know any borders. And we just saw recently with pandemic, COVID, we just understood that health, and I can remember some sentences of one of the health responsible in Portugal when this COVID started in China. She was saying, no, I don't believe it's coming to Portugal. It's so far away. And then in a few months, we were attacked heavily. So we don't want to commit these kind of mistakes again. It was already referred the advance that the European Union has already did in some legislative acts like the Animal Health Law and Regulation on Veterinary Medicinal Products in 2019. But I would like also to stress that since between 2011 and 2022, we had 53% of reduction in antibiotic sales across the EU. This is quite important. Of course, we need to deal with the disease, but the best is to prevent the disease. And I just heard that from my partner there, my neighbor in the front row. It's very, very important to us to prevent. And we need to prevent using, of course, vaccines, improving the conditions, the welfare conditions of our animals, of course, improving the conditions of livestock, etc. And with all of that, we will reduce the need to intervene with the use of antibiotics. And we know that it's a quite difficult situation. The antimicrobial resistance here in Europe is quite difficult to address. And we are launching a new substances and new products, but we still have this problem. Of course, when we talk to work together, we cannot forget the fantastic work of EMA, EFSA, ECDC, OECD, that highlights also the progress that we are doing right now. So this is quite important to share to the world, to share to the other continents, especially across the Atlantic, what we are doing what we are doing very well. What do I believe that we need to do more? First of all, mass production and equitable distribution of vaccines. This is quite important. I can remember what happened just recently in Portugal with this blue tongue virus. It was quite complicated. It affected a lot of sheep in our country, and we didn't have the enough stock of vaccines, and also the serotype was different of the vaccines that we needed. So we applied, in an exceptional measure of the government, we applied the vaccine that was still in testing. So this should not be the case. We should create more research, more innovation to create new forms of vaccines, new serotypes of all the diseases, and spread them to the farmers and create conditions for them to apply. After we have the vaccines, the question is who's going to buy them, to pay for them. This is a huge burden for the farmers also. So I believe that the public sector plays a fantastic, important role on this issue. We need to have the public sector supporting the farmers. If not, just imagine, we had some farmers that had thousands and thousands of animals, of sheep. It was thousands and thousands, hundreds of thousands of euros to spend in vaccines. So it's quite difficult if we want to have if we want them to comply and participate actively in the safety and of course on this health of all of their work. If not, I'm afraid that maybe it will not have their commitment on this. So we need to create the conditions for all the stakeholders, all the active participants could be engaged in this process. We also think that we need to increase some common agricultural policy funding for preventive infrastructure and animal welfare. We know that if we bet on animal welfare, we have good conditions on animals, good feed to the animals, we will reduce the possibility of diseases. So this is the main issue. We need to create the conditions to not create the disease. Okay, so first of all, we need to create the conditions to not create disease. Then we have the vaccines, and then we have the antibiotics. This is my view, my point of view. Adopting a holistic One Health strategy integrating human, animal, and environmental health remains a priority, and we should encourage cross-sector collaboration, strengthen biosecurity measures, support research and innovation, promote sustainability, and, of course, with this approach, I believe putting all at the same table, talking and debating, and especially to understand that what affects one point of the European Union will, for sure, arrive to the other point of the European Union. I will not take too much of your time. I just would like to express my regrets that I expressed already also in the hearing, in the meeting with the Commissioner for Agriculture and Food, Christopher Hansen, because he didn't include the animal health organizations in the European Board on Agriculture and Food, because they accepted the other two, like the animal health was not included, like the human health and sorry, I'm lost here in a way. Sorry, the animal health was not included, but he included the human health and the other health, environmental health. Sorry, I was always thinking about plant health. I don't know why, but the environmental health and human health, and the animal health was not included. I expressed that in the meeting with Commissioner Hansen, and unfortunately, I didn't get any reply, but I will continue to push for it, because if we are talking about one health approach, we need to have the 3 levels of health included on this advisory board. So count on us, count on EPP to continue to defend this animal health, One Health strategy. I believe that, as I just said, we have no borders, we have to address all health, all in a comprehensive view of the health, and deal with all the participants and possible stakeholders on this area. Thanks a lot, and I'm looking forward to hear our distinguished panelists. Thanks a lot.
Thank you very much, MEP do Nascimento Cabral, for your insights and for being our co-host of this event. Please join me in now welcoming Catherine McLaughlin, who is chair of EPRUMA, for her opening remarks.
Well, thank you very much for inviting us and for coming to join our 20th birthday party, shall I say. It's always nice to share such anniversaries. Oh, sorry. Is that better? Yay. Okay, I'll start again. Thank you. Thank you for coming to share our birthday party with EPRUMA. It's always really nice to have friends for these types of celebrations around, so thank you. I'd also like to add my thanks to our co-hosts and to our moderator. And I'm really, really proud to introduce EPRUMA to those of you who maybe don't know too much about the organisation. My name is Cat McLaughlin, and I am honoured to chair EPRUMA, and have done, I think, for 3 years now. I think 3 years. But EPRUMA has been around and has been in my sphere of awareness for a long time. The first ever EPRUMA meeting was held in October 2005. And the people that came together to create EPRUMA, we've got to thank Copa Cogeca, and it was Roxanne Fellow who worked for Copa Cogeca at that time. So thank you, Roxanne. Obviously, Roxanne is now with Animal Health Europe. We also had the FE, and that was Jan Vartan. We had Animal Health Europe, then it was called IFA Europe. So there was Declan O'Brien, plus Alison Glennon and Phil Sketchley, who were part of UK members of Animal Health Europe, and also UK RUMA. And RUMA is the Responsible Use of Medicines in Agriculture Alliance. And I am also very, very proud to chair UK's RUMA as well. The first discussions back in those days that the new EPRUMA started on was responding to the consultation for the 2007-2013 Animal Health Strategy for the European Union, entitled Prevention is Better Than Cure. So you could see the direction of travel, and it was one that EPRUMA was very happy to get involved in. We then widened our membership and we welcomed FEFAC, which is the European Feed Manufacturers Association, FESAS, which is the European Federation for Animal Health, and they joined and they ensured then as well that we covered the wider animal chain. Our first action, though, was to publish in 2008 the best practice framework for the use of antimicrobials in food-producing animals in the EU. We followed those up with best practice guidance in 2015 on the one was titled Reaching for the Next Level on the Use of Antibiotics. 2018 we issued best practice guidance on the use of anthelmintics. We had one published then in 2019 on vaccines, and just last year on responsible use of parasite control in pets. We had new members join over the years as well, so we've now been joined by Access Vet Med, FICAVA, that's Europe's community of companion animal vets, Diagnostics for Animals, and EFAB, which is the European Forum of Farm Animal Breeders. So we've had a lot of work that we've done in the last 20 years. And what we've achieved over that time, sales of vaccines and parasite control have increased, but sales of antimicrobials have decreased steadily. The last SFAC report noted a 53% decrease in antimicrobial sales since 2011. The major livestock farming countries, so that's Poland, Belgium, Italy, the UK, Spain, France, Germany, and the Netherlands, have decreased even more. Between those countries, we've decreased between 55 and 67%. We've also seen very notable decreases in the EMA's priority antimicrobial classes since 2011. And we've also, as EPRUMA, have produced fact sheets on approaches for veterinary pharmaceutical waste reduction and correct disposal. And that's all part of ensuring that we're including the environment in our One Health approach. So I'm really, really happy and honoured to be here celebrating the 20 years of awareness raising on responsible use. And I think I can speak for all of the EPRUMA family when I say that we're looking forward to working more in a One Health manner moving forward. So thank you, and I hope this is a good discussion.
Thank you very much, Ms. McLaughlin, for your opening remarks. All right, it is now time for our panel discussion. So I'd like to invite our panelists to join me on stage. So we're going to start by welcoming MEP Vytenis Andriukaitis, who is our host, and he is from Lithuania and with the Socialists and Democrats group. Welcome. We also have the pleasure of welcoming back so soon on stage, Kat McLaughlin, from whom we just heard as the chair of EPRUMA. Welcome. Next, we have with us Miguel Angel Higuera, who is chair of the Working Party of Animal Health and Welfare at Copa Cogeca. Welcome. And last but certainly not least, we have the pleasure of being joined by Bernard van Gotem, who is Director for Crisis Preparedness in Food, Animals and Plants at DG Santé at the European Commission. Welcome. So you're going to have one microphone going down.
Thank you.
All right. Hello, hello. Working? So let's dive right in. So I have a question for you, Mr. Andriukaitis, to get us started. When you were Commissioner for Health, the Commission launched the One Health Action Plan against AMR in 2017. And obviously there's been progress made since then. But where specifically do you think the EU should focus its attention in this next mandate?
From my point of view, when we started with launching such our One Health Action Plan, frankly speaking, we were very. It's okay. It works.
Feel free to raise your voice.
Yes, I think at that time we were very, very proud that a lot of, frankly speaking, all member states respected it very seriously and kept it into good, attention. And of course, they decided that such action plans require develop national action plans. National action plans was the tool which should be monitored from Commission side, used as possibility to measure how progress is, and how we can improve it. Of course, we at that time we have good opportunity to raise questions that we need to have more strongest ECDC partnership, more strongest, our, EFSA partnership, more strongest EMA partnership. But of course, at that time, it was so difficult to convince European Parliament, to convince member states that we need much more capacities. Also, we have in our hands Health Security Committee, where we discuss some crisis and how can address with those issues. But after pandemic, I was so proud that situation was completely in changes. Everyone started to understand what does it mean. How can we really think about necessity to invest much more in prevention? And of course, it can change situation a lot now. Of course, now we have much strongest ECDC. We have much strongest EMA. We have HERA. It can, of course, all those three entities should, responsible to do much more. But of course, we need to think about necessity to speak about surveillance systems. When we speak about IMR, we need to understand we need to have excellent surveillance system. We have the same methodology, same equipped laboratories, network surveillance is number one, is really speaking. And of course also the benchmarks and criteria which should be more measured, because what is measurable is done. And we need to think about those issues.
Thank you very much. I'm quite struck by the fact that you mentioned a few things, but you started by increased partnerships. So we'll get to that afterwards. Increased partnerships with the ECDC, with EMA, with EFSA. So that's a key thing that we'll get back to afterwards. My next question is for you, Mr. Van Gotem. We're talking about One Health, and we're focusing on the responsible use of medicines in animals, and that involves also having access to those medicines and access to diagnostics. So I'm wondering if you can tell us what steps are being taken to ensure that everyone across the EU, all EU member states, have equitable access to those diagnostics and to those medicines.
First, I think it was mentioned at the beginning, we have the new animal health law, which covers the entire fight against diseases, animal diseases in the EU, and we are talking there about diseases which have an impact on trade. The diseases which are not regulated by the animal health law are left to the owner or to the member states, but because they have no impact on trade. I heard also very often that we need more vaccine. We need vaccine to vaccinate against blue tongue. That was mentioned in the introduction of the Portuguese MEP, which I forgot the name. I think we need to be realistic. It's the same with avian influenza and vaccine against avian influenza. If I take only the example of blue tongue, we have 26 different types of blue tongue viruses. We have probably around 100 million bovine in the EU, and we can reasonably not expect any member states or the Commission to own 100 million doses of the 26 different strains in case one of the strains would appear somewhere. We have a big vaccine bank in the EU for foot and mouth disease, which viruses are not mutated, they are quite clear. We have 40 million doses in stock in the EU, which are available to all the member states in case vaccination would be needed. And you've seen that there was an outbreak at the beginning of the year in Germany of foot and mouth disease, and there was discussion in the press and in the veterinary area about maybe we should start vaccination, but the implication and the consequences of vaccination are so huge for trade and for the farmers that it was decided not to start vaccination. Unfortunately, the outbreak in Germany, for which vaccine was available, between the 40,000 doses, 40 million doses vaccine that we have, it was not used. It was not used, as I said, because the implications are much too high. Unfortunately, it could be eradicated quite easily by the German authorities. So yes, we need vaccine to be available. We need vaccine to be ready, and we ask the industry to be ready, but asking public authorities, being member states or being the Commission, to own millions and millions, 100 million of doses of vaccine against each and every virus which could pop up, it's not reasonable.
So it sounds like you're saying that we need to have a targeted access to necessary vaccines to address active issues as opposed to being kind of on standby for every single virus possible. Okay. My next question is for you, actually, Mr. Higuera. So we've been talking at the macro level. We've been talking about partnerships with ECDC, EMA, EFSA, and we've been talking at the EU level. But I want to zoom in at the micro level, at the farm level, at the farmer level. What are farmers on the ground telling you are their challenges in implementing preventive One Health measures like vaccination strategies? And what are the practical things that can actually, not just theoretically, help them implement those preventive strategies?
Thank you. Yes, of course. I think, and also for the point of view of the farmers, so that is something clear, that also our mind have changed from the last year. So at the end, the prevention is clear. Prevention is clear for us. So why? Because, of course, the necessity of the treatment of the animals is there, but we need to reduce the presence of the diseases. So for this reason, the system have changed, and also the management have changed. Mainly because, of course, we have to protect our animals. So the top in our main business, in our mind, is the biosecurity. Protect our animals for the diseases. Because also when we are talking about the antimicrobial resistance, we are talking about the bacteria, but we have also have the virus. And also to try to fight against the virus, the best option is the biosecurity. The second one, of course, the bacteria and the virus, is the vaccines. To promote, and also the use of the vaccine is something clear in our farms. So, and also it's something that have changed in the last year. We have reducing a lot the use of antibiotics, and also we are increased the spend of our daily basis in our farms in vaccines. So this is the most important aspect that we can fight. So make strong the immunity system of our animals. But also we have to help them. How we can help them? Change our management of the animals. Also we have rethinking another time how the animal has been managed in the near on the farms. We have also identified the pyramids of productions. We are clean the pyramids of the productions. We also have changed system of batches to be sure that the animals are not in touch with the different ages. So all this kind of system have to also try to promote and prevent the presence of the diseases. Unfortunately, the diseases are there. Unfortunately, the bacteria are there. So we need the antibiotics, but for this reason, we have to try to protect them, to be sure that we are going to have not only today, also tomorrow, the antibiotics. But of course, right now, the mentality in the veterinarian and in the farmer has changed. So our focus is in the prevention, biosecurity, protection of the farms, increase the immunity with the vaccines, and also change our system of management.
Thank you very much for that answer. I'm going to a bit more of a philosophical question for you, Ms. McLaughlin. So we're obviously here to talk about the concept of responsible use of medicines. And that definition, that principle has changed over the years. It's come to mean different things 20 years ago, perhaps, than it does today. So I'm just wondering, when you look back over the last 20 years, how has the concept of responsible use of medicines evolved? And where do you see that concept going in the future?
Okay, so I think the concept itself probably hasn't changed that much. The mantra that we have always used in EPRUMA is very much that we use antibiotics as little as possible but as much as necessary. And that has allowed us to steer our course through the last 20 years, and I think will probably take us for the next 20 years forward as well. And basically what that mantra is saying is that we recognise the importance of protecting and using antibiotics as little as possible, so we don't use them unnecessarily, we don't use them needlessly, but when we do have to use them, and we accept that we will have to use them, that we use them as much as is needed, and that's to protect the health and welfare of the animals, our food supply chain, you know, and keep that responsible pattern of animal husbandry. So I think, you know, kind of the actual concept of what we're doing is quite consistent. What we in EPRUMA are doing, though, is we have, you've all got on your chairs a commitment that we have agreed, and I'd like to just kind of draw your attention to it, because I think that commitment is very much leading us down the next 20 years, but very much still with that mantra in the back of our minds. And just to quickly talk through it, it's to promote a One Health approach to veterinary medicine use. So that's recognising that what impacts animal health also impacts both human health and the environment. That we'll promote good animal health and welfare, and that's recognising that need for regular monitoring that we talked about of health and welfare, the breeding techniques, preventative measures through biosecurity and vaccination, diagnostics and innovative feeding strategies. That will facilitate coordination and exchange of information on best practices. That will engage and communicate with EU institutions and relative agencies, because that communication piece is hugely important. That will support transparency on the use of veterinary medicines, and I think we can't forget that as well. We have to be seen as the honest brokers and be accountable for what we do. And we want to continue sharing knowledge by developing awareness campaigns. So I think the concept of what we're doing is consistent. Where we take it in the next 20 years is we've done the easy stuff. You know, we've set that out. We've done the, in the UK we have a comment that you've picked the easy fruit. So we now have to go a little bit harder and a little bit higher, and we'll be starting to look at some of those wider One Health things.
Thank you very much for that answer. Yeah, it's great to contextualize that the definition from what you're saying hasn't changed. We really need to stay the course to actually achieve the goal of protecting our One Health. My next question is for you, Mr. Andriukaitis. So just a few months ago in November, SAPEA, which stands for the Science Advice for Policy by European Academies, they published their scientific advice on One Health governance in the EU. And I think it was the second recommendation was that we need to not work in silos. We need to actually work with each other and to create links at the EU level, national level, and local, regional level. How, practically speaking, do you think we can break those silos? Because the truth is, we do have a DG for health and a DG for animal food safety or food safety. We do have, different areas of expertise. We have someone here who embodies all of them. But practically speaking, how further can we break those silos?
May I start with some very important story, and then we will answer your question. But the important story is related to vaccination. Bernard, you remember lumpy skin disease? You remember that case? And we decided now.
You're talking about Mpox?
Huh?
Mpox?
I
heard monkeypox.
Lumpy skin disease. Lumpy skin disease. And such lumpy skin disease entered from Turkey to the Balkan countries. And then we decided, what can we do? How can we stop spread of those viruses? And we decided to vaccinate cows. And we started to vaccinate cows in Croatia. And was why my big surprise was, when we vaccinated cows, no one cow was against vaccination compared to people. No one was anti-vaxxer movement, It means that cows much clever than some of people,
If anyone's looking for the tweet of the
second lesson I learned, that by veterinarians, you are so lucky, because cows trust you much better than people trusting medical doctors. How,
can confirm
two
that.
big challenges, and as you know, being special envoy universal health coverage, I spent a lot of time dealing with misinformation, disinformation, fake news, addressing, vaccine hesitancy. But in cows and in animals, you have no chance. You're so lucky, It just means that in area of animal health, we need to build trust. When you ask me what can we do, we need to build trust at all levels. Because silo mentality, we can overcome silo mentality only we are building trust with different actors in different areas at different levels and with different, different arguments. Because how can we improve prudent use of antibiotics or prudent use of medicines? Trust is must. And here we need to use all our efforts: education, development, communication strategies, information campaigns, awareness days. Of course, also inviting actors at different levels, at local levels, and asking member states also to understand that now, as never before, important to see multi actors governance. It's a very difficult one, but they have only one way, and it's up now. It's up to us to develop good practices at regional levels, to see how different regions are cooperating. Because one issue is southern part of the EU, another issue is northern part of the EU, centrally, and you see a lot of different options and good practices, dissemination of good practices, building of trust. It's so important. But veterinarians are much lucky because your animals trust you much more than us medical doctors.
Thank you very much for that answer. I mean, underlying what you said is trust. So jokes aside about cows not doubting their veterinarians, it is true that we need to build further trust to break those silos. My next question is for you, in fact, Mr. Higuera. It's not about whether cows trust you with vaccines or not, but it's about the animal health law. So when I was reading up about it, I saw that one of the challenges that has come across is veterinary capacity when it comes to actually implementing and auditing, monitoring the application of animal health law. So I'm just wondering, how do you think the EU can ensure effective implementation of the animal health law in the face of such a challenge of, limited veterinary capacity?
I think when we are talking about the animal health law, the key element is the veterinarian. Also because myself, I'm veterinarian, so I'm here. So
no bias there.
So nobody is going to tell. But at the end, is the key element to try to combine what is the different aspect that we have in front of us. So we have the diseases, we have the farm, we have the human responsibility, you have our consumer, we have the environment. So all these things has to think also for the same view. Because at the end, I'm fully agree with Mr. Andriukaitis. One of the things that we have to build is the trust. So the farmer has to trust in the veterinarian because the veterinarian is going to propose different changes in the farms. So if you don't trust in your veterinarian that these changes is going to be good for you, you are going to have a huge problem to trying to implement it. So the veterinarian has to the first one, to be the friend of the farmer, because you have to trust them. But at the end, you have to be the master. You have to teach them to have the first one, because at the end, in our daily work as veterinarian, the first eye in the farms is the farmer. So we have to teach to the farmer to identify that something is wrong in the farm. Then I go there to the farm and to know what is happening. It is wrong or it's not. But at the end, we have to teach to the farmers to go there. And the second step is also the veterinarian to have also all the tools that they can do it. So early detection, laboratorial tests. Of course, in the cases of the fight against antimicrobial resistance, we need also the sensible test to know exactly the antibiotic health sensible or resistant. So we need to do that. And also we have to be sure that our farmer is going to implement the treatment that we are decided. So all this system has to build this very good relation between the farmer and also the veterinarian. For the reason, the European regulation is key element, because one of the things that we are supporting is that this veterinarian has to be enough power to do the things, but also enough flexibility to can be adapted to the different situation that we can find, because every farm in every country is different. So we have to adapt the rubella collections and also for the farms. We have the veterinarian visit, is key element. If we are not in the farms, we are not going to be able to attack the diseases and also to prevent and control the diseases. So the veterinarian must be in the farms. So, and also we have to do a small tools that we have. Early detection, laboratorial tests, and also, of course, I would like to be a very good supporter that is this needed, we need to use the antibiotics.
Thank you very much. Yeah, it's great that you highlighted the importance of working with farmers on the ground, because like you said, we have limited veterinary capacity, and the farmers are the ones who are the eyes on the ground, who can see what's going on with the animals that they're hurting. My following question is for you, Ms. McLaughlin. So we're talking a lot about vaccination because it's obviously essential to One Health and to limiting the spread of diseases and therefore limiting the use of antimicrobials. I'm just wondering, how do you think different stakeholders can better collaborate to improve animal vaccination programs across the EU to ensure that they follow, all of them, responsible use policies and principles?
Okay, so vaccination is a hugely important program when we're talking about responsible use of antibiotics. As we've all heard, having the right vaccine protocol will help us in the prevention better than cure model. In my day job, I work for one of the farming unions in the UK, and I'm not a vet, so I deal an awful lot with farmers and animal keepers directly. And the one thing that they are screaming for is availability of vaccines for the endemic diseases, for those kind of routine diseases that they are seeing on their farms. And because we're starting to see some of the geopolitical issues happening because of the Ukraine crisis, in the UK it's because of Brexit, because of kind of global issues, vaccines are becoming short when it comes to availability. And I think it's worth having a look at the impacts of that. And what worries me, having stood up and being the kind of the spokesperson for EPRUMA, for rumour in the UK, if farmers can't get hold, and their vets can't get hold of those important vaccines, it worries me that we will start to see us having to reach for antibiotics to try and kind of and solve that issue. Now, I think some of the things that has almost been mentioned as well is, as you were saying, there's the lack of trust that we're starting to see with some of our consumers. And farmers are very, very responsive to the food supply chain and to the consumer fears and thoughts. So I think what we all have to do as stakeholders, as I said in my opening one, we have to be factual, we have to put forward strong and clear evidence, and we have to be trustworthy. And that means being very consistent in what we're saying. That means listening to the science and the evidence. And that's where farmers are working with their vets, because there's lots of evidence that farmers trust their vets as one of their key trusted advisors. So I think this is a bit where some of the guidelines that EPRUMA have created and have published will all help with that. And I think this is where some of the work that the European Parliament, the European Commission, all of the veterinary stakeholders are doing as well, is we can start and put out consistent factual evidence that then helps our farmers and our vets to make very clear decisions, and we then can start and try and reassure our consumers, our food supply chains, our governments, our regulators that actually what we're doing is all responsible and it won't hurt them or harm them, but is actually a good thing.
Thank you very much. It's quite striking that, underpinning all of this is access to vaccines. It's not a lack of willingness or to implement those programs and to responsibly use them. It's actually having access. And these are not like the novel vaccines. These are vaccines for endemic diseases, the things we routinely do. So thank you for highlighting that for us. My last question before we move on to the question and answer period is for you, Mr. Van Gotem. This is more of a curiosity for myself more than anything, but I'd love to hear from you about what vaccines for animal use are currently in development, and also which ones do you think should be prioritized?
First, what is important, and I come back to what was just said about vaccination of the animals, there is a fear in the consumer to eat vaccinated meat. I mean, that is something that we have seen a lot in the last years, being on influenza or being on foot and mouth disease. Supermarkets were put under pressure by consumer organizations not to buy what they called vaccinated meat from vaccinated animals. I mean, the general public is not aware or doesn't realize anymore because they live in the city that animals in the farms are vaccinated against a lot of different diseases. But when there is an outbreak of something and you add a vaccine, that's vaccinated meat, we should not buy it. We should not even buy eggs from vaccinated chicken. I mean, we are becoming crazy. Consumers are driven by, I don't know what, thinking that a cow lives in a nice field in the mountains. No, I mean, animals are vaccinated, they are taken care of well by the farmers, and good on animal welfare also, but they are vaccinated to prevent, what was mentioned earlier, to prevent too much use of antibiotics. Now, the industry, if I come back to the vaccine which I'm dealing with, not the usual one that each and every farmer is vaccinated. And on blue tongue, we go towards a deregulation of blue tongue because we would like to leave it to the industry and to the farmers. Why? Because once in a population you have a blue tongue, the second wave does not kill the animals. I should remind everybody that the first time blue tongue arrived in the EU, it was in Sardinia, maybe 15 years ago. There were 2 million sheep dead in Sardinia. 2 million dead sheep. 2 million. Now, the different strains of blue tongue are circulated. The first wave, as we have seen this year with some strain, has killed some animals, yes. But the disease is there to stay. The virus is there to stay. It's a virus which is transmitted by insects. It will go up and down, a little bit like in the US, where you have a lot of strain of blue tongue, and it's going up during the summer because the insects are going higher north. So we will end up like that. So blue tongue will not be a disease anymore. A disease to be regulated by EU rules. That's for the future, not yet now. And I know that farmers and member states were crying about getting vaccine of BTV3. Yeah, it was a new strain. We don't know how it came. It was not a new strain, but we don't know how it arrived here. And the consequences were dramatic for some farmers, but there is cross-immunization between some of the vaccines, so it has less effect on some. Now, the priority for the vaccination. Foot and mouth disease we have. We have stock. I hope really that we will not use it. The classical swine fever we have eradicated, and we have eradicated through wild boar vaccination. So that was quite efficient. Rabies, we had also vaccination of the foxes, aerial distribution of baits for foxes, and that has been, by the way, the most successful eradication campaign of the EU since ever. Because at least when I was young, we had rabies in France, in Belgium, and because of the co-financing from the EU, it was at the time 35 million écus per year, so a long time ago, écus per year, we have managed to take rabies west. So France was free, Germany was free, Poland was free. I mean, that is a big success from us because of the EU. It's now, we are paying in Ukraine, we are paying in Serbia and in the Balkan area, but it's a disease which is not expensive to eradicate and which has a lot of, the results is huge. But now the people are less afraid of rabies, and when they go to Morocco, they see nice puppies, and they say, oh, that's nice puppies. Let's take the puppy back home, illegally, of course, through Almeria in Spain, hidden in the... And then we developed rabies in the EU, and we had some children dying from rabies in the EU because of that. So that's le revers de la médaille. Alors, the investment for the future. The African swine fever is definitively where research is needed, but we say that since 40 years, and nobody has ever been able so far to have a vaccine which is, I know that there are some on the way, that a lot of people are working on it, it's in the pipeline. I really hope so. I really hope that, as we did for rabies, we will be able to eradicate African swine fever from the wildlife. So once we have an injectable vaccine, we need the vaccine to be able to be distributed to wild boar through baits, and then we can eradicate African swine fever from at least the EU. Voilà, I've been too long, I think.
No, thank you very much for that answer, and we'll definitely keep a close eye on African swine fever. So it is now time for us to open the floor for the Q&As. So I have literally pages and pages of more questions, but I will hold myself to account now. So we're going to have some microphones going around, so I'd like to call on you to raise your hand, briefly introduce yourself, and let us know to whom you are addressing your question. I am going to earpick. There is a gentleman right there who I met earlier, Mr. Jan Wachten. I believe you are Executive Director for the Federation of Veterinarians of Europe. And I'm just curious to hear what your thoughts are.
Well, I was the Executive Director of the Federation of Veterinarians of Europe, but now it's Nancy who's there, and it's in her good hands. But I was involved in the starting of EPRUMA 20 years ago. And I remember very well the first meetings we had on EPRUMA. Also Roxanne was there. And we had some ideas about working together with different stakeholders. We had some ideas about responsible use of medicines, but if I look back 20 years and I compare it with today, we knew very little about the topic. We had no idea how many medicines were used, where they were used, by whom they were used. There was a lot of people who blamed the veterinary sector about the use of medicines, but we couldn't give an answer because we just didn't know. So I think if we compare that to today, we know much better where we are, what is used, where it is used, and now we know that over the past 20 years, the use of antimicrobials in animals has gone down enormously. So it's now, we know it for sure. We have the figures. And even better, we know that not only the use of antimicrobials has gone down, but also the resistance is going down. And why I'm mentioning this point is also to echo the words of Mr. Andriukaitis. Science is the basis of all this work, what we do. We cannot just, what we did in the beginning, find our way in the dark. We have to build our work on facts and figures. So let's not forget that and work on that. But science is not the only thing. The other thing is, of course, the practice, the practice in the field. And nowadays we have these training courses in the 27 EU member countries, for farmers and veterinarians about the new veterinary medicines regulation and the medicated feed regulation. And there the veterinarians and farmers are asked, what are the biggest hurdles you face when you want to reduce antimicrobial use? And well, there are a lot of points about availability of vaccines, etc. That's already discussed. But what comes out in almost all meetings is the husbandry systems. It's very important to have good animal husbandry systems so that we keep the animals under good conditions. And I think an issue there is that the investment, the life cycle of an investment in an animal husbandry system, it's much longer than the life cycle of our ideas and the life cycle of our opinions. So it's difficult for farmers to keep up with new insights and new views. And maybe we have to think about how we can find ways for farmers to do that, to not stick with the old system but follow the new ideas, and maybe the panel has some suggestions about that. The other thing that also comes to the floor often is the quality of the staff in the farms. They say, well, we have difficulties to find good qualified people. So maybe we should not only have this kind of training courses for farmers and veterinarians, but also for people in the field, so that they really understand what they are doing when they speak about biosecurity. Because if you don't understand it, it's very difficult to implement it. But maybe the panel wants to react on these points.
Thank you very much. Yeah, it's interesting that you started off saying that we didn't know how much of antimicrobials we were using before, and it ties into what you were saying, MEP Andriukaitis, about what gets measured gets done. So having that data, of course, has been essential. Does anyone on the panel want to react to those thoughts?
I couldn't agree more. Absolutely. I couldn't agree more. You're absolutely right. We need to go in such your proposed direction. You know, especially keeping in mind biosecurity, educating, creating much more, debates about, raising awareness about that. Of course, dealing with all operators. Otherwise you can see how many prejudice we have in different areas. Look, we all know feeding animals. Yes, feed for animals is GM, based on GM. Please explain to our members of European Parliament that we are using feeding animals using a lot of GM soybean and so on because of proteins. They have a lot of prejudice. Something creates, difficult to their health. Sorry, guys. It's absolutely, we need to, once again, to keep in our facts, science, studies, and, of course, good practices to showing those issues, to developing knowledge and raising awareness and education. I couldn't agree more.
Thank you very much. Anyone else before we... Yeah, please. Kat.
Just... I think on the point about, again, I think you said an awful lot that I absolutely agree with. I think on the education side of stock people, so not just the farmers, but their stockmen as well, really, really crucial. And certainly one of the things that UK EPRUMA is doing, we now have collaborations with our vet schools and our agricultural colleges. So we're actually going into the student generations, the next generation of vets and farmers and animal keepers coming up. And, we are now helping them to understand the responsible use mechanisms, why they're being asked to do things like this, because it is really important that education piece throughout the whole system of looking after farm animals and food production animals, it's what's going to get us through for the next 10, 15 years. So I think that point in particular was really important to make. Thank you.
Thank you very much.
Sorry, I would like to also to emphasize one thing that is quite important, that is the information. With information, we take decisions. With information, we need to have a very strong system to record all the use of antibiotics. We need a system to record what is the diseases. We need a system to record what is the resistant genes of the diseases. With all these informations, we are able to analyze it and also take correct decision based on correct appropriate information. For this reason, and also in this aspect, information is also one important thing.
Yeah, the importance of data cannot be overstated, for sure.
If I can, I would like to come back on biosecurity. I mean, how to basically avoid a disease to enter. In the EU, we have first very strict import conditions. We have probably the most stringent import conditions for food and animals in the world. So we have this protection outside the EU. We have the posters, and that was mentioned by the MEP during his introduction, that when he arrives in the Azores, he sees those posters. Yes, those posters have been done based on EU legislation, harmonized, published in the official journal, and now they sit at the airport. But it comes all from us. But that's the external protection that we have. Then you have the internal protection that the farmers has to put in place. Biosecurity come on top of that. But biosecurity is not an exact science. And we have seen that even farms with high biosecurity have been affected by avian influenza or by other diseases because you cannot be sterile 100%. But it helps. But people have to be aware. The awareness is very important, and those BTSF campaign that we are doing, those exercises that we are doing with the member states to teach the teacher, is there exactly for that, to explain so that they know what to do to increase biosecurity. And the vaccine comes only afterwards, when all those protections have failed. One important issue also is the traceability. Because once you have the disease entering a farm, you need to trace back. And I know that the farmers found it very burdensome to identify the cow, to register the number of the cow in the computer. But that's the only way to be able to trace back and to reduce the impact of a disease in the EU. Thank you.
Thank you very much for those answers to all of you. I saw a hand in the audience over here. We'll try to get one more.
Thank you very much, Chair. My name is Kieran Malooly. I'm an MEP from Ireland. And firstly, I want to compliment you on the work you're doing. I'm listening to this and I'm thinking of my father. We had a small dairy farm. My dad had 22 cows. And I remember when an animal was acting strangely. And my father would start, the posh word now is husbandry. In those days, I thought it was surveillance. Because he would come back and he would say there was something wrong. And he would say, maybe it is a chill. The animal has a chill. And we will wait. And then from time to time, he would make an angry comment when he would see a neighbour or another farmer, and he would see them at the local livestock market purchasing the medicine, purchasing more medicines, purchasing more microbials, purchasing. And he would say, you know, we must look after our animals first and foremostly. We must remember where they are going. That was his blunt message, and I think I'm delighted to hear the work you're doing. However, we now live in a very different world to the world where my father had just 22 animals. Today, as an MEP, alongside my colleague there at the end, MEP Andriukaitis, we will be asked to vote on something called Mercosur very shortly in this Parliament. And as you know, this is controversial, principally because of not just allegations, but indeed some evidence provided in the past in terms of the treatment, the use of antibiotics, the use of microbials, the use of illegal growth promoters in the Mercosur countries. Not just allegations. We have seen evidence in the past. We are getting reassurances now. We're hearing of audits and we're hearing some more details. But I suppose my point is, you said very clearly that people, the consumer, is afraid to eat vaccinated meat. So I asked the panel, what can we do? Perhaps in the commitment number 4, engaging and communicating, should we be including the Mercosur countries in this process? And indeed I asked my colleague, because it's probably unfair to ask the whole panel, but I asked my colleague MEP Andriukaitis if indeed you have the confidence to vote yes to Mercosur based on what we have heard.
That's a spicy question. Okay. Perhaps we'll start with MEP Andriukaitis because it was addressed. Okay.
We'll start on this end and see for those who know me, I'm in the Commission since a long time, and import of Brazil has been challenging several times. More than 10 years ago, we had another crisis from Brazil. But just let's put facts, and I will not go further than that. You know that to import meat, there are several keys. And the first key is you need to be free of foot and mouth disease. So there are 5, 6 states in the EU which are free from foot and mouth disease without vaccination. So those areas are free and can export to the EU. The second key is that the country should be approved for the residue monitoring program. So that means that they have to lay down a plan which is equivalent to the one which we do, that Ireland does in the EU, to verify the use of pesticide, antimicrobial, and so on. The third key is it should be slaughtered in a slaughterhouse which is approved and which fulfill the same public health requirement as the EU, but also the same animal welfare requirement than in the EU. And because of the previous crisis, we have added another key, which is the listing of farms. We are listing farms in Brazil which are authorized to send meat to the slaughterhouse, and only that meat from those farms can come from the EU. And in addition to that, we have a very long animal health certificate, which is signed by the officials in Brazil, who certify that it fulfills a lot of different conditions. So the imports from Brazil are the most strict import that we are doing for beef meat, even if it's zebu, because everybody is always talking about beef meat. It's not beef in Brazil, it's zebu. For those who know a little bit, it's zebu. We are only importing from less than 10 countries around the world. All those keys, it's Brazil, regionalized, Argentina, Uruguay, US, Canada, Mexico, Namibia, Australia, New Zealand, Serbia. That's basically the only country from where meat is allowed. So those are the facts. Now you can debate whatever you think about Mercosur. I will not enter into that. I've been to Brazil with the commissioner, not Andriukaitis, but before him 3 or 4 times to Brazil. So I know Brazil. But facts are there that our import conditions are very strict. And when I hear in the parliament, we are importing meat from everywhere in the world, it is wrong. It is simply wrong. And so we should put, and you should put also as MEP, you should put facts straight. Afterwards, you can debate about whatever you want, but facts are facts. And I want, and I've always done that, I've repeated that to everybody. Those are the key, and I think they are important. There are problems now with Brazil. We have had an audit. The audit is, I think, publicly available. We have discussion with Brazil at present. But I hope, and I'm sure that we will be able to solve that.
Thank you very much. Yeah, I see MEP Andriukaitis itching
Okay,
to comment.
now you can understand why I am trusting Mercosur. But I can tell you a story. When your farmers were very happy. When they banned import from Brazil about 9 months. Oh, house was excellent, Commissioner. You know, I visited Ireland. They told, you are doing excellent job, you know, because now all Europeans are buying our beef from Ireland. You know. Protectionism also is very simple. Right? You need to understand it. Politically, of course, very, very sensitive issue because you need to calculate your voters, you know. And now, especially in France, now I see, I spent 5 years doing those issues. Of course, when we started the first round of debates about Mercosur, you remember, we proposed all those keys. And of course, not only keys, keeping in mind also all environmental requirements, keeping in mind all requirements related to use of pesticides, to monitoring situation. As you know, we have the right to send our missions to control situation and to send to see how can be done. Of course, the main issue was not because of food safety, but because it was fraud. Because at that time in Brazil, they, you know, it was detected fraud because they do not use in their system, they do not use properly following their own rules. And we stopped import from Brazil because of trust. Not because of issues which were detected as diminishing food safety standards. It is clear no one, you know, allowed to enter EU market if it's not respect our highest food safety standards. We are not negotiating on food standards. Never. Please trust me.
The word trust is coming up a lot, yeah.
I should have added, of course, just one sentence. I should have added, of course, that any agreement with third country, which include SPS agreement, they do not change our import conditions, nor our import controls. So the controls and the requirements to import food are the same if there is an agreement or if there is no agreement. It doesn't change anything.
Mr. Higuera.
Sorry, but I would like to be not so much polite about that. Maybe you don't know me. I'm Miguel Higuera. I expert in the pig sector from Spain.
I see your tie has little pigs.
So you know that when we are talking about Mercosur for the language, I used to travel a lot to give advice for a lot of companies in Mercosur. So I only want to say one sentence. In Mercosur and in a lot of Latin American countries, it's absolutely different that you can find in the papers that you can find in the field. That's all.
Ooh, giving us a lot to think about there. I'm mindful of time, and I may regret this, but I'm going to take one more question from here, because I saw this hand up earlier, and then we will move on to our networking drink, and then you can ambush all of our speakers to ask them your questions.
Thank you. I'll be very short. First, thanks for acknowledging my presence 20 years ago, and I'm happy and proud to be here 20 years later. I haven't changed, have I? No, my question would be to the speakers, what if you had one advice to give to EPRUMA for the next 5 years, let's say the next legislative, on One Health, what would you tell us to do to promote One Health?
Oof, and I'm going to add a layer of complexity. One sentence. Perhaps we'll start with Mr. Van Gotem. Oh, okay. Oh, we're deferring. Mr. Andriukaitis, it is okay.
My sentence is simple. Please keep in mind trust, and please do what you can do to raise the level of trust. Because without trust, you have no chance to convince consumers and convince farmers, of course, for sure.
Thank you. I mean, I know you're with EPRUMA, but if you have, we'll come back to you at the end. Reaction. Okay.
I would say the awareness of the medical profession, being vets or doctors.
I think we have the knowledge, so we have to be sure that we can transfer the knowledge. For me, the training is key element, but also the surveillance and the controls and also the information to control all the process, and then training.
So Kat, reacting, so you got trust, awareness, and the importance of information and data. 5-year plan.
I don't think I would disagree with any of those points.
Wonderful.
And I think, for me, I think the one thing, EPRUMA will be around a lot longer than I will be its chair. And I hope that EPRUMA continues to develop. And actually, I think those 3 points are good guiding stars for EPRUMA going forward.
Well, thank you all very, very much for your engagement. We could have kept going for probably at least another hour, but that marks all of the time that we have together. Please join me in giving a warm thank you to our host MEP Andriukaitis and our co-host MEP Nascimento Cabral. As well, thank you to our partner EPRUMA and happy 20th birthday. And a big thank you to our speakers for sharing their insights and their time with us. And last, but certainly not least, a warm thank you to our audience member for your great engagement and questions. And thank you to the Parliament Magazine for the privilege of moderating this discussion. We certainly covered a lot of ground today, and it's really impossible for me to distill it in a one-liner like I asked y'all to. But what stands out to me most is the urgency in all of your answers. I could feel the urgency of incorporating One Health in this next mandate, in the policies moving forward. So thank you for conveying that to us as clearly as you have. I'm sure you all have lots of questions, so with that, please join us at our networking reception, which is just over there, and our panelists will be with us, so please do feel free to approach them with your questions. Thank you once again.